Hi, today we're going to talk a bit about a diet. Which kinds of diets do we have for cancer? So in cancer, ketogenic metabolic therapy, ketogenic means something, right? It means that lots of patients, in most of the patients, will use a ketogenic diet, or at least a low-carb diet, okay? So what is a ketogenic diet? A ketogenic diet is a diet in which we use very little amounts of carbs, usually less than 20 grams of carbs per day. We use a small amount of protein, of meats or other kinds of proteins. It's not a hyperproteic diet. And the rest of it, like 70 to 75%, is fat. So, oh my God, it's so much fat. It's not that much, It doesn't have to be that much fat. There are other ways to get into ketosis. For example, even a carnivore diet, if you fast a lot, like one meal or two a day, you can get into ketosis. But mainly, to get into ketosis, what you need is to lower your insulin. Insulin is a hormone we produce when we're exposed to glucose. So if you eat something that turns into glucose in your blood, your pancreas will produce insulin. Insulin is an anabolic hormone, and it's a growth factor. So it stimulates anabolism, including tumor anabolism. So it stimulates tumor growth. This is one of the benefits of ketogenic diet, is reducing insulin also. So when you lower your carbs in your diet, okay, you lower your carbs, your insulin drops. It drops so much that we begin burning fat for fuel. So our liver breaks down the fats into fatty acids, and these fatty acids can be used for energy, to produce energy by all our cells. Of course, small part of our brain still needs glucose. We don't know how much is that amount, but certainly it's not 130 grams a day like they used to say, maybe 50. But this small amount of glucose, and also red blood cells need, will be produced by your liver. Our liver does neoglycogenesis, which is producing glucose. It breaks them down from glycogen, which is the storage we have in our muscles. But we can make glucose from lots of other sources, okay? Including amino acids. But we don't want to do that because we don't want to break our muscles, okay? So this is like the last resource our body uses. So we lower our insulin, okay? Our liver starts breaking fat. And our liver also produces ketones. So some of the fatty acids are turning to ketones. Ketones is like the beta-hydroxybutyrate, acetoacetate, and acetone. Okay? So these ketones, they can go to our brain, for example, and our brain can use ketones for energy better than it uses glucose. So it's great for brain fog, it's great for memory, it's great for cognition, it's great for energy, right? So our brains thrive with the ketogenic diets. Okay, so you don't get foggy or you don't get tired, and like people say, oh, I'm afraid if I cut the carbs, I won't be able to reason right and to work. No, this is just not correct. Studies show, including, that ketogenic diet can prevent the cognitive decline in the beginning of Alzheimer's disease. So it's actually great for your brain, for your cognition, and for your memory. Besides of that, okay, the ketogenic diet and the ketones, they're anti-inflammatory. They prevent muscle loss, muscle breakdown. So they actually prevent cachexia, which is one of the leading causes of death in cancer patients, as long as you eat enough calories and as long as you stimulate your muscle and you're not all inflamed, because cachexia is an inflammatory disease, okay? So it doesn't matter how many calories you eat. If you're all inflamed, you lose muscle. But the ketogenic diet helps you prevent that from happening, okay? So this is the ketogenic diet. So how does it look like? For example, how does it look like, ketogenic diet? Okay, so you can eat like 2 or 3 eggs in the morning, and then a piece of avocado and some nuts, and then for lunch you have mushrooms, broccoli, or Brussels sprouts or asparagus, and then a salad and a small piece of fish or meat or chicken, right? And then in the evening, you have the same thing. Or you don't have breakfast at all, you fast and you have 2 meals a day. It doesn't matter how you get into ketosis. You can do it eating a very classical ketogenic diet with 75% fat, 5% carbs, and the rest of protein. Or you can have you can do intermittent fasting with a carnivore diet, as long as you get into ketosis and as long as your GKI is less than 2. What is a GKI, Janaina? GKI is we make this calculation. We use the glucose in the glucometer, then we measure in the finger, pricking your finger, and the ketone levels, the BHB, the beta hydroxybutyrate levels in your blood. And then we calculate this. You can do it in the Keto Mojo. It's a good glucometer for doing that. It does it automatically. It puts it in an app, makes your graph. Or we can also, we give you an Excel table that calculates it for you, okay? Usually we want the glucose to be very low and the ketones to be very high, so we have a GKI less than 2. If you have a GKI less than 2, it means your diet is okay for you. For example, let's say you're trying a ketogenic diet and your GKI is never under 2. Maybe it's time to change to a higher protein, less fat diet with fasting, and then you can get it there. So this is very individualized. It depends on every person, okay? Why a GKI less than 2? Because this means the ketogenic diet is therapeutic. It means we have an impact on cancer. And some studies show that. The lower the GKI, the better the response to the therapy. The more pressure we put into the tumor, okay? And the more you're protected from treatment too. So now that you understood what is a ketogenic diet, okay, it doesn't necessarily mean drinking fat all day, okay? We can use a more Mediterranean one, which I think is great, with olive oil, right? But we can use also MCT oil. MCT oil, it turns into ketones in your liver almost entirely. So instead of using coconut oil, you use MCT oil for doing that, okay? So there are many ways to raise your ketones, and actually you can also drink exogenous ketones. The best ones are the ketogenous esters, not the salts. But the salts can help you too. So many strategies to boost your ketone levels, okay? Why is that? Why anyone would do that? Because the ketogenic diet has many, many advantages in cancer treatment. One of them is putting pressure on the tumor. You know the PET scans, right? We use glucose as contrast dye, as a dye. Why? Because cancer captures glucose. It uses glucose much faster and in much more quantities than a normal cell. Cancer ferments glucose a lot, very quickly, for many reasons, not only for energetic reasons. Cancers use glucose for building up, for producing more cells too, okay? So, for cancer, glucose is so important for energy, for building up new cells. If you do ketogenic diet, you're lowering the supply dramatically. Of course, you never end it, right? Because our body produces glucose a lot. That's easy to see. Get a type 1 diabetic and withdraw insulin. In hours, his glucose will go to 600, right? And have a ketoacidosis because they don't have any insulin. This doesn't happen to us because we're not type 1 diabetics, so we have insulin, okay? So there's something people are worried about. Oh, but if I do ketogenic diet, I'll get into ketoacidosis. No, there's nothing like that. A ketogenic diet never boosts your ketones the levels that ketoacidosis does. Ketoacidosis is like 30. Okay, the ketogenic diet, ketones go up to 3, 4, with a long fast, maybe 8, 9, never 30. And your pH, your blood never gets acidic. No, it's always normal. Always normal. Your glucose is low. In ketoacidosis, diabetic ketoacidosis, it's high. So it's a completely different situation. I'm an endocrinologist. I tell you that. I know that, okay? So there's no way, unless you don't produce enough insulin or something's wrong with your metabolism, you have a genetic disease or something, an innate metabolism error, that you'll get a ketoacidosis going on a ketogenic diet, okay? So, ketogenic diet puts pressure on the tumor, the ketogenic diet is anti-inflammatory. It's anti-inflammatory in many ways. It's anti-inflammatory for the brain. So it's anticonvulsivant, so it's good for epilepsy or when you have brain mets or you have a brain tumor. So it actually helps with this anti-seizure treatments, and it helps you use less steroids, which are not good for you at all because they raise glucose. So the ketogenic diet helps with that. Ketogenic diet reduces edema, and that's very, very well seen in brain tumors, and there are lots of studies showing that. Ketogenic diet reduces the side effects of chemotherapy and radiotherapy. So when you do radiotherapy, the ketogenic diet intensifies the lesions on the tumor and protects the healthy cells against radiation. So that's very interesting, right? It's a dual action, which is very interesting for us. Ketogenic diet boosts energy levels, and we have randomized clinical trials showing that. It reduces cravings for sugar, because some cancer patients, they complain of cravings. And of course, because you're losing weight very rapidly, you're inflamed, and cancer uses lots of sugar and glucose. So they usually want sugary drinks and sugary food. So there's some patients, they complain of cravings, and the ketogenic diet helps with that, right? Ketogenic diet helps maintain lean mass. And we have some studies, randomized clinical trials. We have this KetoComp series of studies in clinical trials, in which it's been shown in many, many tumors that ketogenic diet helps maintaining the lean mass while losing fat mass, especially visceral fat, which is the one we want patients to lose because that's the one inflammatory. That's the one that actually contributed to cancer appearance in the first place, okay? Also, we have some studies, some randomized clinical trials in late stage, in end stage disease cancer patients, in which a ketogenic diet improves quality of life. So even in patients in late stage, in end stage disease, the ketogenic diet is still worth it, as long as it's well done with a good nutritionist and a doctor seeing you through, helping you doing it. Okay, some patients may have issues with digesting fats and may need enzymes. Some patients will do better with a diet with more protein and more fat and more fasting than lots of fat. So it depends. Okay, so that's why we say there are lots of ways to get a GKI under 2. And not necessarily has to be a classical ketogenic diet. And some patients will have to do a low methionine diet, which is a vegan diet. And the vegan diet can be ketogenic too, which is great. It's not easy to do, but it's great if you can do it. And sometimes we'll need to do a vegan diet because you'll be in a ferroptosis protocol, which is a protocol we use, or if your homocysteine levels, which is the blood test, are very high, and homocysteine levels very high make your tumor resistant to chemotherapy. So you want to lower them. We do this with vitamins, we do this with some strategies and fasting, and of course, with the low methionine diet. So it doesn't necessarily mean you have to do the same diet ever and all the time. Let's say you don't manage to do a ketogenic diet, but if you manage to go low carb, it's already good for you. Because we have studies showing that if your glucose levels rise during your treatment, even during your small period, you're in hospital for surgery, you have a worse prognosis. You have bigger recurrence rates and bigger mortality and lower survival rates. So having high glucose levels is never good. And it's not very high. It's like we have some studies in breast cancer showing that if you have a median glucose levels of 130 milligrams per deciliter, I don't know it in millimoles, but it's 130 milligrams per deciliter, you already have worse prognosis. So it's very subtle. And of course, a low-carb diet is better for controlling your glucose levels, okay? So this is basically, the biggest advantages of a ketogenic diet in cancer, okay? There are more, but I'm here to answer all your questions. And I strongly encourage you to read some books I suggest to you. Happily for you, the books are all in English, which is very bad for Brazilian patients because some of them don't speak English, but that's good for you. and some websites in which you can also read and see testimonials from patients, which is very, very encouraging. Okay? Bye-bye.